And welcome into our business spotlight on WCSJ. As well, we've got a guest in studio that we've talked to before, and with it being Stroke Awareness Month, as May starts to wind down, we're going to bring in neurologist Dr. Isaac Mezo. Doctor, thanks for joining us, and welcome back to our studios.
Thank you for having me, Mike. I'm glad to be here.
Yeah, so we want to kind of focus on strokes and inform our listeners a little more about warning signs, that type of thing, but just the basics on a stroke. We've all heard it before, but what exactly is a stroke?
Absolutely. So a stroke is any insult to the brain that will result in impaired blood flow, which could result in bleeding in the brain, or it could involve ischemia or lack of oxygen getting to the brain. So a piece of tissue dies within the brain, which carried out some function in the body. Now that that tissue is dead, you will have some kind of deficit. That's what a stroke is.
And is it something that you can kind of look for signs or anything that might clue you in that you could be at risk for a stroke, or does it just kind of happen sometimes when you're not expecting it at all?
Well, it will happen all of a sudden at any time, but there are definitely signs that which should prompt you to call 911 immediately. One of those symptoms is a facial droop. Another one would be weakness of an arm or a leg, or numbness and tingling on a face, arm, or leg. Slurred speech would be another one. Loss of vision would be another one. All these symptoms, and you don't have to have all of these, but any combination of these symptoms should prompt you to call 911 at once.
Yeah, and obviously the importance of calling quickly, a better response, better chance you have to not have any kind of long-term damage, right?
You bet. Time is brain. That's a very important saying that we have. The reason being is within a certain amount of time, we're able to do interventions in the hospital that if you're outside of this time window, there really is not much that we can do.
All right, so Morris Hospital with the primary stroke certification, can you tell us what that means?
Yes. That means that we have a medical director that's experienced in treating stroke. At Morris Hospital, our director, Dr. Peter Analidis, as well as myself, we contribute to the stroke team. We also have a stroke code team arrival time to the bedside within 15 minutes of the patient arrival. Furthermore, we have lab testing, advanced imaging available 24/7. We have a hospital with neurosurgical expertise or the ability to transfer a patient within 2 hours. And we have a designated stroke unit. All these requirements, among others, make us a primary stroke certified hospital.
Yeah, and just hearing that list, you can tell, obviously, the importance of working fast and getting help as quick as possible. As far as other resources, what else does Morris Hospital offer for someone if they've had a stroke?
Yeah, after a stroke, we have our Rehab Services, which provide physical therapy, occupational therapy, and speech therapy to these patients so they can recover their deficits, from their deficits, I should say. Also, we have a stroke support group that meets quarterly who offers our Greater County area support.
Before we get to some of the final points, we talked about some of the warning signs and things to look for. What about lifestyle leading up to when a problem might come about? Are there things we can do to try to be healthier while we're healthy, so to speak, so we kind of try to avoid the possible warning signs that could lead to a stroke?
Of course, the most important thing in preventing a stroke is controlling your blood pressure, and that would mean eating healthy. Not smoking. If you smoke, you have to stop immediately. Controlling diabetes. Again, comes with a healthy lifestyle of eating healthy and losing weight. Those three risk factors, diabetes, high blood pressure, and smoking, are the three leading factors for stroke.
All right, some good advice there. And if people want to find out more information, what's the best way they can get a hold of you?
Yes, they can call us at our Morris Hospital Neurology Specialist Office. Our phone number is 815-942-4506, and they can make an appointment to come see myself, Dr. Peter Analidis, or our nurse practitioner, Stephanie Henline.
And you and Dr. Analidis are based primarily in Morris. Do you visit the other hospitals as well if need be?
We have an office in Morris, one in Shanahan, and we go to Morris Hospital. We're also consultants at another hospital in Joliet.
All right. The number again is 815-942-4506. You can also go online, of course, to morrishospital.org/neurology. Dr. Mezo, any final points on today's program?
The most important thing, remember, time is brain. You have any of these symptoms, you call 911.
Better to be safe than sorry.
Absolutely.
Right? It is Stroke Awareness Month, and we thank Dr. Isaac Mezo, neurologist with Morris Hospital, for coming in for today's Business Spotlight with Morris Hospital, heard every Friday at this time on WCSJ. Dr. Mezo, thanks again for coming in.
Thanks for having me, Mike.